your origin, course, branches of termination of the arteries of the inferior extremity. Okay. Origin, course, branches and termination of important arteries of the inferior extremity. Now the basic, the arch of the aorta, the heart, just want to you imagine the whole human body standing like this, and you have seen your dissection. You have to just not imagine, now you have to picturize. Now what is it? The origin, course, branches and termination of important arteries of the inferior extremity. You have finished the superior extremity and then the thorax. And now we are going into the inferior extremity. Now overview. This presentation focuses on crucial arteries that supply the inferior extremities. Understanding their anatomy is vital for clinical practice, surgical planning, and diagnosing vascular diseases. Key arteries covered: femoral artery, popliteal artery, anterior tibial artery, posterior tibial artery, and dorsalis pedis artery. Now, why I am telling you, see, I told you the first day I met you that every structure is important. And the vascularization of the lower limb, due to your own decision, you can be judging the flow of the blood in the lower limbs. And you just imagine the big vessels, these femoral artery, popliteal artery, anterior tibial artery, posterior tibial artery, dorsalis pedis artery. These vessels can be having different types of clinical presentation and due to different types of diseases of the lower limb. Because this is important, because see, if there is two toes of a diabetic foot is black, he comes with a black your toes are black. You ask if he is a diabetic, you feel the pulsation on the arteria dorsalis pedis, how it is going on. You feel your own, when you go home, you feel the artery and pulsation. Also you come up, you feel the pulsation in the femoral triangle. Now, I will just narrate a story that these type of diabetic foot I have been treating, and seeing these two toes, you just don't go for an amputation. As far as my experience saying, just you have to remove, you have to focus. Then where will you amputate? Only the toes or your Syme's amputation from the, now from this portion or this portion or your below the knee, above the knee, which portion? Now, you go clinical investigation and then you have a radiograph, X-ray of the portion on the foot and also your leg, and try to evaluate by seeing the X-ray what is the condition of the toes, and you do a angiogram if possible. Now, in diabetic foot, very bad diabetic foot, you don't be in a hurry, you take the consultation of medical treatment. If it is a sugar, blood sugar is 400 milligrams or more, insulin is going on. And now, why I'm stressing on this part? Because it can be due to some, you do a USG, ultrasonography of the total vascular system in the lower limb arteries, and see with a color Doppler study exactly where there is any thrombus or any constriction or due to atherosclerosis. And also this is aggravated by the diabetes itself. This is one thing, these are the just minimum investigation of you don't go, you're not, I told you angiogram, but go for a USG color Doppler study and also a radiological examination to see if any portion is there. You see in USG how much tissue loss is there. So I have seen now that this is, I've taken it as a project that why you ampute. The toes are not hampering you. It is dead. And dead means dead, black means black. It is a Charcot's foot. Now it is just, you see in your dissection table, that few things have become black, hand and the toes have become black. Though it was formalinized, but that is formalinized, it was okay. But I'm just telling you the peripherally how it is looking. These bodies are not, was not having any gangrene or something like that. We call it dry gangrene. But it's dried with the weather or something like that. You become a conservative surgeon. There was previously the Gorkhas, they have a bojali in their waist. And if they take out once, they have to get some blood. If not, he'll cut his own and then put in. It was a belief earlier. I think with change of time and this, that means this is one thing, the belief is still this thing to the new generation that you have the scalpel, you have the license, but you just don't go cut. How much you will cut? And also there is Buerger's disease. It is like in the neurological effect having, see Buerger's disease, you smoke, it comes with a small toe, blackish dry gangrene, then you investigate for arteriosclerosis and the type of pain. See, a Buerger's disease, intermittent claudication. That means when he walks, he's walking, suddenly there's pain. Then he rests. Again he starts walking. This is a sign that he might be having intermittent claudication. This is one important part, and any day, of course, I will find an opportunity to exhibit to you people. And the person I was started my lecture with is Mr. Chatterjee from Mallarpur, just after Shaitya, next station. He came, 3 surgeons, means I'm taking the hospital surgeon's name, I'm not remembering it. he came, he heard from people that আমাকে পাটা বাদ দিতে বলেছে, and he had a whole the dorsum of the foot, there was a scab that tissue is also rotten or purified, and about and underneath the granulation tissues and the margin was, you can when you see, go and see that the margins were a bit, you can see the epithelialization. On visual, the epithelialization means you under microscope or under histology you will see something. But I'm telling you, clinically you can know that this is healthy tissue. Now with this, what happened? I started dressing with honey, anti-diabetic drugs, and his wife accompanied each and every dressing with us, with my team, and we taught her from the very first day, because every day it's not possible, or alternate day is not possible. Even they cannot stay in the hospital, expenditure. These things are, you have to see the cost-effective dressing. That is honey, my experiences for the last 30 years. Now, Durga Puja was coming every 10th day. They used to come give fasting blood sugar, and then she used to bring some food, rice and sabji and fish and all this. After 2 hours, we took a PP. By the time, after getting that report, we are just seeing how much it is improved in controlling the diabetes. Okay. Now, just before Durga Puja, he told me he is a Brahmin and he has some pujas to conduct, family puja. Then he told me that, Dr. Bo, ami pujo korte parbo to? So I took my red pen, I carry in my desk, I have all types of stationery. I took my red pen, I said, Tumi pujo korte parbe, ar ঘট ভরবে পুকুরে নেমে. I told him that you will perform the puja, but before the puja starts, there's a ritual. You go to a pond or Ganga or whatever lake, whatever is available in your nearest house. Then the person who will conduct the puja, he'll go and knee deep and put your colors with, and then come out. And he did it. And I had not amputated the foot. The toes, honey has such this thing that enzymes and all, it automatically, it was already dried, the tissues became soft, only we just took out, just took the forceps and just gently moved it, and that got dismantled. Okay, now this is the thing that all things, you be very careful, don't be panic. Are pa baad dite hobe, are pa baad dite hobe mane? Now, the key arteries covered by femoral artery, popliteal artery, anterior tibial artery, posterior tibial artery, dorsalis pedis artery. Femoral artery. It is in the femoral triangle. And See, in this aspect, you can see the pulsation. You see in the posterior aspect, the popliteal space, you can see the pulsation and also feel it. Then you go to the arterial dorsalis pedis, you will feel the pulsation. And accordingly, by clinically you have to judge. Again, now come to modern investigative procedure. You go for a radiological investigation to see the bony structure, bony any pathology, and also you do an USG with the color Doppler study. That will give you enough information of the local tissues, or if there is any pockets of pus or something related to the foot. And then you do see, actually with these three things is sufficient. Main is your clinical. Second, investigation in these three, USG and radiological. Now, angiogram, angiography, you have to know for your NEET PG. So, a good MBBS is a good postgraduate. Just have this in your mind and target 60%. Okay, now we'll go come. Now, this is the picture of, see, this is the external iliac, this is common iliac, internal iliac, lateral, sacral, inguinal ligament, this is inguinal ligament, and this is the deep femoral, and you can see internal pudendal. Now, deep femoral, lateral femoral circumflex, then you go to the femoral artery. The genicular, genicular means the artery supplying the joint, genicular, genu and thigh. Now, this is the popliteal, this, and anterior tibial, the posterior tibial, fibula, arterial dorsalis pedis, over here. This is the medial malleolus, and this you palpate and go in front of the knee joint, ankle joint, and you see the dorsal arch. You can feel and see this is supplying all the phalanges and this thing. This is the arch here, and now the posterior view. Now see right external iliac. Now deep femoral, this is the deep femoral, lateral femoral circumflex, and see this femoral artery here. This is genicular, the supplying the joint, and this is the popliteal, and you see the peroneal here, the anterior tibial, posterior tibial. Now here lateral plantar, medial plantar, plantar arch, this is the plantar arch, supplying the small bones of the foot. Eita tomra mathay rakho. Then everything will come easy. Easy, why I'm saying it will come easy in the sense that these specific places over here, the femoral triangle, the popliteal space, the anterior and posterior division of the tibial. Now, this is the thing, then all these compartments you will be having as a small, as you do your dissection, and you see the total. You don't have to draw like this, you just do a line drawing, just like this, branch. That your textbooks are giving enough. Huh? And one thing I tell you, now see, this is the lateral tarsal, medial tarsal, now arcuate artery, and see the dorsal metatarsal artery. See, a lady comes or any person comes, I would say person, but with a toe injury, yes, not dry gangrene or complications of diabetes, I'm not saying. Then just don't go and chop. That lady might wear ornaments. If a small girl comes, just don't chop up and like you do an extensive surgery and then you come out and tell the बहुत भालो होये छे, बहुत अच्छा हुआ है operation, but patient मर गया. Okay, so you have to take care and also select sutures according to this. So a girl to an adult. Okay, now see, this is the popliteal muscles. This is the popliteal artery. This is the anterior tibial artery, see, and this is the tibio-peroneal trunk. The tibial is posterior here, anterior tibial artery. Now superficial peroneal nerve. This is the flexor digitorum longus muscle. Now you can see the posterior tibial artery goes, tibial nerve and goes, yeah. Major part, okay. Now, the circulatory system, an overview, structure and function. Circulatory system comprises of arteries, veins and capillaries around the tissue. Relevance of lower artery supply. Now, critical for mobility and overall limb health, compromise of blood flow and lead to some ischemic condition. Diagram includes the level diagram of the arterial supply of the lower limb. So I told you the condition. Now, femoral artery. It can be a short note of 4 marks or some question from your femoral triangle. Okay. Now, origin arises from the external iliac artery passing under the inguinal ligament, enter the thigh. Now, in the, you can palpate, you can feel the pulsation. And in neonates, if you cannot get a blood, you want to take the blood. So it can be just 24 hours baby, it can be 2 years old. Then you just feel the pulsation and then the arterial pulsation, then medial to it, you just do a femoral tap from the vein. You can take 5 cc. Bacha. Now, superficial epigastric artery bordered by the femoral runs anteriorly down the thigh, entering the femoral triangle bordered by the inguinal ligament, sartorius and adductor longus. Body is in the dissection hall. You just, before it is taught to you, when you visit the demo room for any class, you see it. Take your book. After the bone or anything is taught to you, you see the location. It is prosected, dead body is there. So you can see it. Okay. Now, yesterday I was very happy. I was a bit late. I informed Vijit sir that I'll just be late. I was late by 20 minutes. Already Vijit sir started taking the class. And after all, he left. As he left, I entered. So, but I saw the students who were there. वो भगोलबार नहीं था, बैग लेके भागा नहीं. One of your friends was demonstrating how you think, and everyone is crowding. That I want to see for the Agami 9 months more. This should be the practice. I just kept mum. I just kept silent. And the person, your friend, was demonstrating very well. Now everyone, and because see, আমাকে পাত্তাই দিল না কেউ। এটা আমার I feel great. Yesterday, every day I have some story to tell. তো আমার খুব ভালো লেগেছে যে এইটাই করবে তোমরা, ঠিক আছে? আর now superficial epigastric supplies the abdominal wall. Superficial circumflex iliac artery supplies the lateral wall of the abdomen. External pudendal artery supplies the external genitalia. Profunda femoris artery, deep artery of the thigh, major supply to the thigh muscular structure. Termination, transition into the popliteal artery at the adductor hiatus, located at the upper border of the adductor magnus muscle. You can see the adductor muscle, and then you see the going to the adductor, your thigh musculature, and transition into popliteal artery to the adductor hiatus, located at the upper border of the adductor magnus muscle. Now, popliteal artery, origin, continuation of the femoral artery after it passes through the adductor hiatus, course positioned in the popliteal fossa, posterior to the knee joint, deep to the tibial nerve, and above the gastrocnemius muscle. Beautiful picture. Now, actually, there are sometimes cysts develop in the popliteal fossa, and that you have to operate. One. Second thing, there can be a big lipoma. You have to operate. So you need not panic. You can make an incision, and then you open. You will see the cyst. Now this is modern imaging. You have to do a plain radiograph or X-ray, and also an USG. Okay. Now termination. The bifurcates into the anterior tibial artery and posterior tibial artery. Like once you enter the main gate of Santiniketan Medical College, this block 2, block 1, this goes to the canteen. But one path that goes, and that's like that. It's a highway. The main branch of the artery is the highway, and it's having specific names and specific your connections, bypass and all this. You go to Kolkata, any town, any city, or any village, it is the now anterior tibial artery. Now branches off from the popliteal artery. MCQ. Where it originates? 1, 2, 3, 4. Okay. These small, you have to make your own questions. Okay. Now, course passes through the interosseous membrane to reach the anterior compartment of the leg. Now, you have read superior limb, the interosseous membrane and all the muscles are there. So there is structures, nerves, vessels are piercing or going through. The same configuration in the upper limb and lower limb is the same, more or less. Now passes through the interosseous membrane to reach the anterior compartment of the leg. Now branches, anterior medial malleolar artery supplies the medial aspect of the ankle. Dorsalis Pedis artery continues to the dorsum of the foot, crucial for foot blood supply. That beginning I told you. Now, termination becomes the dorsalis pedis artery at the ankle, provides blood to the dorsal aspect of the foot. Posteriorly, plantar arch, plantar aspect of the foot. Now, dorsalis pedis artery, this one is short note. Continuation of the anterior tibial artery as it crosses the ankle joint. Branches, medial and lateral tarsal arteries. Supply structures of the tarsus. Arcuate artery forms the lateral aspect of the arterial supply to the foot, and anastomosic with the plantar arteries. It is all interconnected. Now, clinical relevance. Clinical relevance, dorsalis pedis pulse, dorsalis pedis pulse, valuable landmark for assessing peripheral blood flow, palpable between the first and the second metatarsal. First and the second metatarsal. Okay. Now, আজকে বাড়ি গিয়ে শু খুলবি তখন দেখে নিবি, প্যালপেট করে নেবে, you'll never forget. Now, posterior tibial artery, branches of the popliteal artery, course descends within the posterior compartment of the leg, deeps to the soleus muscle and runs medial to the fibula. Now, when you dissect the leg, there will be a compartment, and each supplies one compartment. Okay. Now, descends within the posterior compartment of the leg, deep to the soleus muscle, and runs medial to the fibula. Branches, fibular artery supplies the lateral compartment muscles and contribute to the nutrient supply of the fibula. Medial plantar artery supplies the medial aspect of the foot and contributes to the digital arteries. Lateral plantar artery supplies the lateral aspect of the foot and forms part of the plantar arch. Termination bifurcates into the medial and lateral plantar arteries at the foot, contributing significantly to the vascularization of the foot. Plantar arch, short note. Now, created by anastomosis of the medial and lateral plantar arteries. Anastomosis, plantar arch. Now, branches, digital artery supplies the toes, providing essential blood flow to the distal regions of the foot. In Purulia, 4.3, less than Darjeeling, but there's no baraf. Okay. Function towards collateral service, allowing blood continuity even if one pathway becomes obstructed. Dharo Goria or Splanade, you are in Splanade, you see that you want to go through Central Avenue or Lenin Sarani. Now you will take D route, or you either go D route or you go through some other lane. So that is the thing, that is basic thing is that it supplies the foot and clinical application, surgical consideration. Knowledge of arterial anatomy is critical for surgeries like bypass, grafting and amputation. Trauma management. Rapid assessment of arterial status is essential in lower extremities injury. Identification of pulse, dorsal studies and posterior tibial can help gauge perfusion, gauge perfusion. Now this is one thing for anything. If there is a hit in the your trauma with the humerus is broken and then he comes like this, or your leg cannot move. Quick assessment. And immediately, but if you take 1 hour, then the mob will come not the, even if you don't fear mob, you might have high security as if the emergencies goes on. There is no, people are nice, people are okay, huh? They won't disturb you. But for your callousness, I would say, your callousness, the patient may die. And আমি হাত ধরবো না, কিছু হাত দেবো না, আরে ভাই ব্লিড করছে, তোমার তো গ্লাভস, তুমি গ্লাভস পরবে, এ করবে না, ধরো চেপে, একদম ধরো। My father used to say that your hands are the best instrument. See, if I am performing a hysterectomy or any cesarean section, that might be profusely bleeding, then you hold it, clamp, 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 no, you just hold it tight. And slowly you get the instrument. You have to think twice by clamping what type of clamp you will be using. There are clamps in for your gastric surgeries, the intestinal clamps. So you have to just, there's a special clamp that you can clamp with that. Even you don't, if it's profusely bleeding, then you just hold it and then to ask your assistant to put a loop of a ligature and then tight. So, now vascular disease, understanding arterial pathways aids in diagnosing conditions like peripheral artery disease, with where ischemia leads to claudication. Okay. Now, radiological imaging of arteries, imaging techniques, ultrasound used for initial assessment of blood flow and detecting clots. CT angiography provides detailed 3D images of arterial blood vessels. MRI angiography, non-invasive imaging modality of visualized blood flow. Purpose: assess arterial patency, identify stenosis or occlusion. Example images include images to visualize findings from these imaging techniques. Common pathologies: arterial diseases, atherosclerosis, character by plaque buildup leading to narrowing and potential occlusion of the arteries, thrombosis from blood clots and arteries restricting blood flow, varicose veins primarily venous but indicates compromise in venous return, potentially affecting arterial function. Now, clinical implication: these conditions may lead to critical ischemia and necessitates early intervention. Now, summary of arteries, of key arteries. The femoral artery originates from the external iliac, emerges beneath the inguinal ligament. It plays a critical role in supplying blood to the anterior thigh and branches into the several important arteries, including the profunda femoris, which supplies deeper structures of the thigh, as well as the external pudendal and superficial epigastric arteries. The femoral artery terminates at the adductor hiatus, where it transitions into the popliteal artery. What you do is that you take 6 pages or 7 pages and draw a portion of the artery, femoral artery, popliteal, each page. So you have a big, enlarged view of the diagram. You label and put a note. আজকে করবে, আজকে বাড়িতে গিয়ে করবে, half an hour লাগবে কিন্তু। Done. Again 10 PM যখন তোমার একসাথে বসবে, তখন ওই ট্যাব ফ্যাব নিয়ে বসো, বা যখন তোমার খাতা নিয়ে বসো, এটা নিয়ে বসো, then revise. মানে once this is done, you prepare like this, then you will get 70%. মানে half of the crowd failed. I'm not creating panic. I'm not giving threats. But I'm telling you how you will restructure in your own way the lecture given by a specific any teacher. You do it from day one like this. Okay, এখন আর পিঠে খাওয়ার জন্য বন্দে ভারতে গিয়ে পিঠে পুলি খাবে নর্থ বেঙ্গলে, হ্যাঁ, মায়া ডাকছে ভালো খেজুরের গুড়টা, নো, forget it, you buy it in the market. There are sweet shop. Now anterior tibial artery branches from the popliteal artery coursing through the anterior compartment of the leg, passing through the interosseous membrane. It terminates as the dorsalis pedis artery, supplying blood to the dorsum of the foot. Key branches include malleolar artery and this. Okay. At the thing is that you draw this is the tibia, this is the fibula, I think level. It can be done like this or just straight line, and now posterior tibial artery, also branch of the popliteal artery. The anatomical relationship and branching patterns of these arteries are pivotal for understanding the vascular supply of the inferior extremity, influencing both surgical approaches and the management of vascular disease. More than 90% doctors will give ampute. Okay. The plantar aspect, see. This is all dressing by honey. Now, এক করে short. See, I didn't do any mechanical to remove this debridement of the whole scab, because it's slowly the granulation tissue is going undermining. Okay, and it releases something. Slowly, without any anesthesia, that is removed. Next. Aggravated. Now see the granulation here. This is the epithelialization. That is healthy healing. Next. See here. Next. The eight, see. No. See the tendons here. Next. That scab is removed. See. Next. See the auto imputation. Okay, next. Next. Previous slide. Patience. Dorjo. And you have to know what is the things are going on inside. Now, because I have seen many amputations, of course, in some condition I had to ampute, but in common foot injuries or something like that. But I would say, like Simon's amputation, then you won't get a good prosthesis, and even if you get it, it won't be affordable by 90% Indians. Now you see the population, and they see the people who you are going to cater. Things are not as you are dreaming or imagining of our healthcare system or any healthcare system in the world, I'm saying, because COVID proved it. The Americans, their hospital is not this thing. Okay, now this. Raka. Next. Next. He was a subject of our MTech students' research in IIT Medical School. And I took these few patients, around 10 patients, to IIT Kharagpur to tell their story. Whatever you see, you are dissecting, this is, or prosected body. Kaan mein bag, jhola. I tell you, you just search. You don't have to dissect. Of the prosected body, there might be a nerve that is bit abnormal. Its root or something like that. You take pictures, you see, and then go home to see again, or immediately the teacher concerned, you see, then you can make a small paper from third year or second year, or you can send a paper to the anatomical society or any this thing. It will be published, a small publication. Oh, anatomy, don't. Every subject is important. So, seeing is believing. When I lectured on this topic, honey and wound healing, in Singapore, that was the initial stages of my research. No one talked, no one asked questions, because we are the largest user in the world. আমি ওয়ার্ল্ড বললাম, আমি দেখিনি ইন্ডিয়ার কোনো সেরকম করে। আমার বিদেশ যাত্রা হচ্ছে সিঙ্গাপুর, বাংলাদেশ আর নেপাল। So wish you all the best. Don't panic, don't panic. You must achieve, you are the best, but don't waste time, please.